Hi friends, I'm Siju.
I'm Saji.
Welcome everyone to our YouTube channel.
So finally, we are thinking to start our video in English because we've got a lot of requests actually telling us to do the videos in English.
As you know, we are doing lots of videos in Malayalam language, and I think more than 500 people got a job directly from India without any agent, with the help of our group.
Yeah. So we thought, why can't we do it in English? So also the other people, not the Malayalis, but also the other part of the world or other countries can also come, that people can come and do their work in UK. So today is a small video regarding interview questions, NHS for the carers. So we'll just go through that.
Yeah, actually, you know why we are doing this video? Because when we did our interview questions in Malayalam language, we got loads of requests from around the world. We got some requests from Pakistan, Bangladesh. We are so proud of that one because they're all requesting us to do a video in English language because they can't understand what we are talking. But they understand what we are talking is something beneficial for them to come to UK.
But the thing is, the interview questions was in English, but the halfway it was in Malayalam and English. So they couldn't actually recognize what was the video regarding.
Yeah, so they understand what is the video. They can understand the questions because we are showing that questions in the screen. But when we are explaining the things, we are explaining everything in our local language, Malayalam. And that's why they are not able to understand what we are explaining.
So we thought, okay, we'll just do a video. We'll try to do a video in English and see how is it going to work.
Okay, in this video, we are going to explain different types of questions we can expect when we are facing an interview to get a job in a UK, especially in the healthcare sector. So, as you know, so many people got job in UK as a carer or senior carers. Now in NHS, they have loads of vacancies for band 3 support workers. If you have a nursing background or more than 6 months experience in the healthcare sector, you have the chance to apply for that jobs.
Yeah.
Don't forget, if you have a nursing qualification and if you got a chance to work as a band 3 in NHS, you have a chance to become an RN within 1 year. There is, as per new criteria for the NMC registration, if your manager can sign a paper for you, you will get a chance to become an RN in UK. So, if you are working in a care home or domiciliary care, and if you have the experience or education in the healthcare sector, you must apply for NHS jobs. Saji will explain the process of applying for NHS jobs because we did a detailed video before how to apply for NHS jobs. And now Saji will explain how you can apply for that jobs.
Okay, so usually as Siju told that we are NHS are recruiting healthcare assistants. Most of them, I've heard most of them, even my NHS is recruiting. So usually if you are working as a nurse, like you were working as a nurse and you are a HCA here, or you worked in a healthcare sector, they are recruiting. Mostly, the dependents who are working over here as a HCA, they are also recruited. So you can easily get the job over there. The main thing you need to focus on the thing is, you need to check the track job. That's the site where the NHS published their vacancies.
Okay, if you can check the description box, I will add the link of our previous video, how to register for NHS jobs. You will get the link, and in that video we clearly explain what's the process for applying for a job.
Okay, so before you start, if you want a job as a HCA or a band 3 in the NHS, you have a certain process. The first thing is you need to apply for the job. So that's one step. That's the first step. And then the interview and your job. The first step for getting a job or to filling an application. So when you fill the application, the main thing you need to focus is that you need to sell yourself.
Yeah.
So you have so much of
experience and qualifications.
Yeah. You have questions on that basis, on that application in which you can sell yourself. You have to show your abilities in that. You need to don't try to write in just one sentence. You need to describe what they're asking. You need to describe the application, all the questions that, for example, they will be asking, how can you show yourself or you were in your previous job. So the thing is, you need to show that you were working as for example, working as a team, you are really resilient, you're really has a good team player. So, you need to sell yourself to show that you are
You are capable for
and
doing
you
that
are the right
best.
person they want to recruit. So the way you sell yourself is the way you're going to get your job. Yeah. The thing is, in UK, the main thing is the way you express yourself and the way you sell yourself, you will be more prioritized in the recruitment. So the first thing I'm going to recommend to you is sell yourself. When you do your application, sell yourself, do all your step-by-step application, give your correct answer for the questions, and then you will be obviously be recruited. Selected on for the interview. The second one is the interview, the day itself. So when you go for the interview, be calm. That's the main thing. Be optimistic and be really ready for the interview, and be pleasant, the first thing, and then be cheerful, and then what I was saying, just give the answer whatever you have done in the application. You have sold yourself, so you sell yourself in front of them. So the way you talk to them and the way you really sell yourself will make you actually recruit them, you to the job. So write what you have been. Actually, they will be asking about all your past experience, what you're going through, and the role of the carer, as to what your responsibility and what is your role. So you need to sell yourself. That's the only thing I have to tell. You need to boost yourself to show that you are the best person for the job.
Now we can go for the questions. Saji will explain each of the questions because she's having so much experience in the caring sector, because she is working here more than 13 years in different positions. Then she knows something about caring sector, because I'm not from, as you know very well, I'm not from healthcare sector, but I'm trying to help you all. And as you know from our group, more than 500 people got job without any help of any agents or without paying any money to any agents. So we are very proud of that one, and you can join our Telegram and WhatsApp groups. You will get lots of information from that one.
So, okay,
we'll
go for that. Okay. So the first question, obviously, for every interview, it will be introduce yourself. So there's no need actually to explain that for you. So introduce yourself. You need to tell yourself whatever you're coming from, your background, whatever is it. You just explain yourself, and then just tell your education. So the next question will be, tell me about your education and your career. So you can just tell about your education, what you were doing, and your work experience, what you were, and then when you are you may be. So let me tell, these recruitments are entirely from UK.
I want to make one thing clear, that for NHS now they are not directly recruiting from abroad. They are giving COS to the candidates. They are right now in UK.
Yeah.
That means if you are working as a carer or senior carer in any of the UK care homes with a sponsorship, you can change that sponsorship to NHS, because NHS is giving sponsorship to the candidates. They are right now in the UK. Yeah. They are not providing COS for candidates from abroad for band 3 category, but they are giving for band 5 category.
Yeah. So the other thing is, so if you are working, whatever he's told this, so you can just explain the work experience you are in UK. So you work in so and so, when you are a healthcare assistant, you were working like that, and you can just explain about it. Okay. So that's the first question, just your introduction, your work experience, your education, and everything.
Okay, one more thing I want to add that one. When they are asking the first question, tell me about yourself. Don't take too much tension. This is just a warm-up question, because they want to make sure you are comfortable in that interview. That's why they are giving some questions like this one. Everybody knows when they are asking this question, everybody know you will give a correct answer, because we already by hearted these answers. So don't try to by heart these answers. Try to say something.
Yeah, the main thing is, if usually you will tell, oh, I'm Saji Moplitis. I've studied my nursing in India, and I'm doing this here. So just maybe you can just try a different way that you can just actually impress them. So just tell, I'm from India. I worked this much, and I'm over here working here as a HCA, but this is I'm enjoying my job in that, because I am a very lovable person and a caring, and I'm really compassionate about caring. So you can just just include something more, and not only just say your personal thing, but just include something more about caring. And
But when you are adding something more, make sure you know about that.
yeah.
Okay, don't lie too much, because if you lie too much, and they will ask from that question, that words.
Yeah. All right. So then in the other, when you say about these things, they will be asking maybe another question like, so what is your long-term goal?
That's a good question.
Yeah. So if you you are a HCA, you work as a healthcare assistant. So if you are a nurse, you can go for the answer like that. So I work as a HCA over in England, in the UK, but I'm a nurse back in India. So my long-term goal is going to be a registered nurse.
Nice, yeah.
So I just love to work in NHS to become a NHS. So sorry, to become a RN. But the thing is, I want to actually service in NHS, so I can really support the people and also look after them and really caring. So you can just add something for that. So that's your long term. For the people who is not actually who is not a nurse, it will be a bit,
Yeah. You can say.
Usually, the band 3s, even you can work if band 2s. So the HCAs are really band 2s.
Band 3 they are recruiting for.
So
NHS.
band 3 they are recruiting. So you will be a senior, like a senior HCA as a band 3. So you can just tell them that you want to improve.
You can simply say, I want to do my BSc nursing after getting some experience.
Yeah, you can tell them that I want to go for further nursing studies, or you want to upgrade yourself to a manager, something like you can just tell them. So that's your long term. You can do your NVQ3 there because the NHS is providing it.
Yeah, you will get the fees. They will pay the fees for you.
Yeah.
Then you can
So
do
you
whatever
can
you
just
want.
tell that you want to improve, do your career, improve your career and become so and so. So just think about your career plans of your long-term goals and then go for your interview, because that will be a definite question for you.
Okay, that will be okay. Now, as a profession, what questions we can expect? Now we have, this question you already explained is a common question. Whenever we are going for an interview, we can expect that question.
Yeah.
Now we want to know what type of questions we can expect from healthcare sector.
Okay, so usually the next one will be about the qualities about as a carer. When you work, what is your qualities, your strengths, your weakness to become in your career thing, or work as a carer or the HCA. Okay, so what do you think?
What you will tell if they are asking about your weakness? Like in the healthcare sector, I don't know what we can say.
Okay, so the weakness. So we'll go for the strength. We'll go for the weakness last. Okay.
Okay, that's
so when we go for the strength wise, we can just usually it's the same actually. There's no difference with the health sector and the thing. It's a common question actually. If I go for the strength, if somebody asks me, I'll tell my strength will be a teamwork. I'm a good communicator. And the other thing is I'm really resilient. I love to work in in stressful,
difficult situations,
a stressful environment. I'm a very good mentor. So, I've given a 3 or 4 example, but just elaborate with that. Elaborate yourself, boost yourself that you were doing that, blah, 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 blah,
Yeah, this blah, 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 blah. Okay, as you know, when you are saying about the strengths, make sure, try to add something, some experience, previous experience. That will give a boost to your answer.
Yeah. You can just tell if you are a good communicator, because you can just tell I have done my IELTS and I have passed with this and I can communicate with all such a kind of people. I can understand whatever. So in intake, I'm a very good listener. That is a very good thing. The patients, you can just tell examples, because mostly in UK with all elderly people and mostly having dementia, so people will be different and confused. So I'm a very good listener to hear, so I love to hear what they are saying and then give them the most important a service or good care for them according to what they need. So that's another actually advantage or the strength of a person. And the other one, what I tell is I'm a very good hard worker. I'm a team player, because when you want to work in a trust or in a group, you should be having a team and you should be leading a team. That's what you have to tell. You are a good team leader, but you are leading a team as well. If you say that, they will be like thinking, okay, you will be okay in the group, So you can just tell that as well. And also you're really resilient. Means even if you work in a very environment, like a stressful environment, as you all know, NHS is really, really busy. And so if you work in a stressful environment, if you tell that, they will be really happy with that. Yeah.
Okay, that's a good answer. Okay, now what's the next question is, what you will say as your weakness?
Okay. If I'm on this in this situation, I'll say, because what I feel is about my weaknesses, I can't say no to anything. So
that's a big weakness.
Yeah, because if in NHS, you're not going to get paid after you're limited, like it's
Exactly.
3:30 or 7:30 to 8. After 8, they're not going to pay you. Okay, so you need to stop your job on that day. But most of us, we are going to stay there till
most of these days,
an hour or excess time. But we need to stop. When you see, it's different for different people, but usually the foreigners, like us, we are going to work there. We'll be going to staying there.
They don't have any breaks. They are not getting time for eating.
And the other thing is, whatever they're saying, we can't actually say no to them. We'll just go do the job, and then
Actually, what's happening. They are saying their weakness. They are staying up to 9 o'clock, 1 hour extra. But this one is mainly because they are very afraid to say no, because whenever their managers are saying do this one, they can say if that one is not their job, they can easily say no, but they are scared to say no.
The other thing is, it's different actually. If you are a HCA, you're not going to stay there for an hour or something. For the nurses, it's different, because we have a PIN number. We need to save our PIN number, so we need to finish our job. So it's our responsibility to find the time and finish your job within that time frame. Okay, so I'm not going to blame the NHS. I'm not going to blame anybody. But this is what I'm telling. According to me, I can't say anything no to anyone. I think that's the weakness. What I feel.
Okay, you are saying your weakness is you can't say no to anyone.
Yeah.
What you are doing to overcome that weakness?
I'm just trying to say no to everyone, but you need to prioritize your job. So if you think that that job or that thing is actually really important and just priority for us, we have to do it. So if that is not a priority job, we say no, that's it. That's
not only that one, if when you are working as a team, you need to make sure you are doing your work mainly. If somebody else is saying to do their job, and if you are going to do that job for them, then you need to spend your extra time there.
Yeah.
So you need to prioritize your job first. Then when you have time, you can help others. Otherwise, you need to say, no, I don't have time.
Yeah. What you're saying is correct. But when you work as an in charge or a team leader, you can actually, you need to prioritize and delegate. That's what I have to tell you. You delegate your job to them. So when you start job, like whoever is going to recruit as a band 3, you are going to be the team leader for the band 2s, like the HCAs. So you are the senior HCA. So you need to delegate the job when you start your work.
That's enough. Now we can go to the next question. Right. Okay, what question we can expect?
So the next question, as usual, you can go for you are a HCA, but it's not a nursing thing or something. But as a HCA, so you're looking after the patient, and the patient is going to tell you that the patient is in pain. So how will you recognize that patient is in a pain, and what are you going to do?
That's a good question. Yeah. I don't know.
When you do work as a HCA, you are really caring the patient. So you will be more knowing about the patients. And then when you see the patient is in pain, usually their mannerism, the way they are in pain, you will come to know when you see their facial expression, their mannerism. So what they expect is, when you see the patient on pain, you need to escalate to the in charge, and your nurse in charge or the nurse who is looking after, and then documentation. That's the other thing. So you need to recognize, report, and then record it.
Okay, this one is one important thing. When you are coming to UK, make sure you are doing your paperwork properly.
Yeah.
Because from I know so many people coming from India, they lost job recently because they are not doing the paperwork, but they are doing their job properly, but they are not focusing on their paperwork.
Yeah, usually the foreigners, they just do what, like, they
They
care the people,
they
but
do very
because
hard work.
we don't have that culture, about the documentation and everything back home. But here the main thing is, after your job, like after you do your caring bit, you need to record it. Whatever is it, you need to record it. Yeah. So the first thing what you need to tell is, you need to recognize the patient by the facial expression or the gestures. You can just say that, and then we will actually explain, or we'll just let the in charge or the nurse in charge or the nurse who is looking after about the pain, and then you need to record it. Okay.
Okay, the next question we can expect is, I saw so many like question papers. Then I can see one question. What do you mean by safeguarding?
So safeguarding means the process of helping those adults or the children to keep themselves safe, or putting in place plans to protect people who cannot protect themselves. The thing is, as you know, as it explained, it's something like, it's an act just to protect the vulnerable.
Yeah, that's a correct word.
Yeah, vulnerable people. So it may be an adult, like an elderly adult, or a children. So the other question you can get it from that is, can you just explain a scenario where you have come across a safeguarding, and how did you what's your responsibility, and how did you manage it?
Okay. Nowadays, when we are attending the interviews in healthcare sector, they are asking so many scenario-based questions.
Yeah. So mostly when you do your interviews, or when you go for the interview, it's better to give your answer in a scenario base. If you just include any instance or example for that, then they will be really happy. So they know that you have worked somewhere and you have that experience. So if in this scenario, I'm going to tell that if like we were working as, like I was working in a night shift, and then I had a colleague who was with, like we were managing together a dementia patient, we're trying to change the patient, and he was really rude with the patient. So it's a safeguarding, actually. It's a, like, it's something like rude in the sense they physically abuse. It's like, we had scenarios like that, like example like that. You can just explain that had a physical abuse, and then you escalated to the manager, and then it went to the safeguarding, because in England, abuses are one major thing. Yeah. So that will go to the safeguarding, actually. So you can just explain a scenario regarding that.
As you all are working in the healthcare sector, maybe you already faced these scenarios already. Then just explain based on your real life experience in UK. That will be good.
Yeah.
Okay, what is the next question we can expect?
So the other one is regarding about they can ask another question. Okay. So you are a HCA, you work so you're working today, and you have a patient who was on the floor. The patient had a fall. What are you going to do?
Okay, if it is in India, what we will do?
So actually in India, we are going to lift the patient up, but here we are not allowed to do it. There is a certain process, actually. Anyway, as a HCA, what are you going to do?
That's a good question.
Yeah. So if a patient is on the floor, you're not going to lift the patient. You're going to pull the corbel. There is a corbel in each room or in a bay. That's an emergency corbel. So you just pull it up and ask. So everybody's actually know there is an emergency. So everybody's going to come to you. So before that, make him comfortable, in the sense, don't move the patient. You can just put a pillow or something. But before putting a pillow, you need to know that the patient is having any neck injury or head injury. So it's better make the air, a surrounding just free from any falls or trips, and make him comfortable. The other thing is, so the nurse will be there. They're going to assess the patient. So the only thing you're going to do in NHS is going to pull the emergency bell if you find a patient on the floor. As a HCA, that's your job. You just go pull the bell, call the emergency out, and then the nurse and the in charge, whoever is there, they are going to assess the patient, and they're going to do everything. You are the person who is going to see it, then you are going to do a day text. So when you start the job in NHS, you know what is day text. So it's a process, actually, to know that if there is anything happen, we are going to escalate to the more authorities what had happened. So it's a process. You may be knowing it now. It's a day text. It's the same like a documentation. So we are just documenting that a patient had a fall.
Okay, that's good. Yeah. Okay, what questions we can expect more than this?
Okay, so the other thing is, Another about the caring bit is, can you tell what is communication?
What is the importance of communication?
Yeah. So the communication means there is two types of communication. We have verbal and non-verbal communication. So usually when you say about communication, the good thing, like the most important quality of a carer or a HCA should be having a good communication with your team. Then only you will have a good, team, and you will have an effective care for the patients.
Okay.
Yeah. So when I told you about the verbal and the non-verbal, verbal means we can just talk direct, face to face. That's a communication. That's a verbal one. But non-verbal is what you actually through your eye contact, your gestures, your mannerism. So that's a different type of non-verbal communication. So maybe they will ask the difference between the communication and the verbal and the non-verbal communication.
I got a word from your last sentence. Abuse. What do you mean by abuse? Can you please explain that one?
So it's a vast question. It's a vast subject.
Because I saw so many times, when like our group members from our Telegram and WhatsApp groups, when they are sending like termination notice or suspension notice, I can see a loads of abuse.
Okay, so abuse is a really big subject which I can't actually explain. So abuse is different types, different type of abuse we have over here. So we have physical abuse, sexual abuse, institution abuse, neglect, and
okay, that's fine. Can you please explain physical abuse? I think I saw so many physical abuse.
Physical abuse means actually when you care for a patient and the patient, if you abuse him like physically, what I meant is hitting them, pushing them, giving punch and physically abusing the patient, like physically hurting them. That's what I have to tell you. Physically hurting them, then it's an abuse here.
Today, one of our group member lost job from a care home because of a physical abuse.
Yeah, because usually the physical abuse, they come to know when they have bruises, the patients, when you are getting, usually when in NHS, when we get a patient who is having a lot of bruises in the body, we're going to do a safeguarding. So this is the time when you're getting the safeguarding up. So we do a safeguarding. If the patient is coming from a nursing home, if a patient is coming from a nursing home and the patient having multiple bruises on the body, it may be from a fall or something, but still we are going to do a safeguarding because they want to know whether the patient has what happened. So that is a physical one. And the other one is a sexual abuse. Sexual abuse means actually the person will be actually very fearful when we go to them. Usually if it's a female, a male going to them, they will be really, really fearful, and they're expressing they're telling about he's just sexually abusing me. Then we are having that thinking of, then we are raising a safeguarding against sexual abuse. Then there is psychological neglect. So the neglect is another one. What we do safeguarding. It's like if a patient is coming with personal care, there's no personal care, so that's a neglect. And if the patient is having pressure sores on the body, if it's a category 2, multiple category 2 or category 3, then it's going to be a SOVA. SOVA safeguarding, that's a different one. So that's a different type of abuse, So it's a simple. I'm just elaborating so much. Too much on that, so I'm just leaving it. So that's an.
As a carer, no need of knowing all these things like SOVA things, nothing. You just need to know about what
SOVA is what I said is a safeguarding. Okay, so you need to have a basic. Okay, and now SOVA is called as AAR. It's a different one. It's not safeguarding. That's the form. So before it was SOVA, but it's AAR now.
That's good.
Okay.
Make sure you are not doing any abuse in your workplace. And if in most of the care homes now, they are putting CCTV cameras, and they are finding out so many mistakes from the carers, and they are removing, they are suspending, they are terminating these carers.
Yeah.
So be very careful.
The thing is, you're getting a good opportunity to work in a different country, and you are getting a good remuneration as well. So it's better. I know it's really challenging and very physically very, very hard to work as a HCA, because I have been working as a HCA before, so I know how was it. So, but it's challenging, but still you need to have, because the patients what we are getting is dementia patient mostly. They don't have loss of memory. And do
They
you
can't
think if a
remember
patient is having a mental capacity, they're not going to hurt you? So the patient is not having lax capacity. That's why they're going to kick or whatever they're doing. So if you do the same, it's going to be an abuse and you will be terminated if they're getting to know that. So better do your job and go work, go back home. Yeah.
Okay. What's the next question we can expect? I would like to ask a question. So many team members ask me, what are the main qualities we need to become a good healthcare professional?
Okay. So that is a good question. Actually, most of them you will get this question for sure. For most of the interview, they are going to ask you. So the qualities of a carer with whoever is working in a health, it's not only the carers but also whoever work in the health care, because you're going to care about a patient or a person.
Care about
someone, yeah. So the main thing is you should have caring. So you can tell caring, empathy, compassionate, helpful, kind.
I think that one is one good word, kind. I'm very kind to.
And very helpful. You can just express yourself. You can just tell your qualities, and
I think you can add something from your home experience, like I look after my grandfather when he's ill, when he's bedridden. I am looking after all of this.
Yeah, the thing is, whatever you're going to tell your qualities, you're going to explain. The very thing I'm telling, the most important thing, what you have to think is, when you give your specific answer, you need to give the examples. Give an instant for that. So
it's very easy to add an instant because you all are working in the care home sector, and otherwise in a healthcare sector, you can give answers very easily.
Yeah, you will be knowing it. We are doing this video. Who is working on over here as a HCA? So you know better than us, but we are just giving you just a guidance to go for the interview. Yeah. And you will be more knowing better than me. You will have more experience than
about
yourself, because I don't know who you are, what your qualities are. You just express what you can. Just give them a detailed about explanation about you.
One more. I will tell you one more time. Don't lie too much. We need to be in the middle. Then you will be okay.
All right.
The next question we can expect is a common question in all sectors. If you are going for a healthcare sector or a bank sector. Okay, my interviewer asked me this question when I did my last interview. If I am giving this job, what you will do extra for our company?
Yeah. So that's a good question. Actually, it's a really interesting one, because they will be asking you, if I give you a job, what are you going to give a return back? So obviously, if I am in that place, if I am doing the interview, I would say that I'm going to work as a team, and I'm going to support the patient and give the most important, whatever I can give is person-centered care. That's the first thing I am going to give. I can give what the person need. I can give the maximum of that to the patient, and then support the team and work as a team, and we'll have actually a good development of our, if I work in a ward, I'll just try to lift my ward.
Yeah. I will do teamwork to improve our team.
Improve our team and lift my ward as the best one on the hospital. So you can just boost yourself, that you can just be...
The simple answer is, you need to tell, you can make a difference in the situation, like a positive difference. Yeah. That's a simple thing.
Yeah. And then you can just explain that, I'm a very good mentor, so I can just do mentorship. I can just lead other one, teach them.
You can tell, in your previous job, I'm working as a senior carer, and I help 2-3 carers to become a senior carer.
Yeah. It's like not helping, you can teach them different. I have this much, I know to cannulate, I know to do that. You can just tell them. So I can just help them with the mentorship. I love actually to teach, teaching me, so I can be that. And also I can help the person to do whatever they want, the patient effective one, the person-centered care. You can just tell everything actually to them. Yeah. So that's a good question and an answer for that. Yeah.
Okay. I would like to ask a question, because so many of our team members lose a job because of that one.
Yeah.
If you see 2 carers is fighting each other, otherwise they are talking in other language in front of the patients, what you will do as a senior carer?
Okay. So the thing is, it's different in NHS. You're talking about the nursing homes, or the care homes. So the senior carers are the ultimate one over there. They are the the team leaders or the team,
especially for the residential care.
They're no nurses. But NHS, it's different. So if you have any concern, you are a band 3, so you are looking after band 2. Okay. So still, even if you have any concerns, if there is a fight between the HCAs, you need to escalate to your manager or to the in charge who is working. So you have a nurse in charge, you have the specific nurses on each bay, but you need to escalate to your nurse or to your nurse in charge. If you are not really want to escalate to them, you can go to the manager. So the manager is going to, so you can put a written complaint that they are using the language, even you told them several times they're not using it. You can just give a formal complaint to the manager, or just tell them not to use the language in front of anybody, or if they are fighting, escalate. So the other thing after that, the manager or the in charge is going to take both of them to a separate place and they're going to talk, and that's all the difference. So that's what you have to do. The main thing, whatever is happening in NHS or in your job, you need to escalate. Don't forget it, escalate.
Yeah, even if you are working in a care home and if you are seeing something unusual, you need to let your senior management know these things.
And another one is a day text. Usually we do it, whatever, if there is a fight between 2 HCAs or 2 staffs or whatever, if a patient, something, whatever is it, we do the day text.
Okay. Well, what do you call in the care home sector, the day text?
Day text is an incident form actually in care homes.
Care homes, okay.
You know, the incident forms when the patient fall, or there is a, the personal, employee related one, you do an incident form in care homes, but in hospitals you do a day text.
That's good. That's good to know. Okay. I think we cover almost all questions.
I think it's not a detailed question. It's just 1 or 3 random questions we just told you. But there are different questions they can actually raise to you. But this will actually help you. I think we have covered a bit of that, but this would have helped you a lot. Yeah?
We are expecting.
Yeah.
Hopefully, we will do more videos in English. And
so this is our first video. So there will be mistakes and there will be downs in this video, but hope this will help you a bit.
Okay. We are planning to do some more videos in English, but that is purely based on the viewers and subscribers we are getting from this video.
Yeah.
If you are getting lots of views or lots of comments or lots of subscribers from this video, definitely we will do more videos in English in future.
We'll try. That's what I have to tell you. Not really a great video, but we are just trying to do the videos in English, but we'll try. That's what I have to tell you. If it's going to really help you guys, please comment down and also subscribe our channel. So we'll be coming with new videos. Yeah. All right.
Okay.
Thank you.
Thank you. Bye-bye. Take care.
Take care.